Hi, this is Dio. This is the third lecture of the Dio Navi Surgical Manual series, the Image Merging and Scan Process. Let's start. To produce the Dio Navi Surgical Guide, both CBCT and oral scan data are required. There was an analog surgical guide that was used before, but it was produced by taking a CT twice. And now, most digital surgical guides require an oral scan data as well as CT data. Why do you think does the digital guide surgery needs both types of data? And if the oral scan data is required, how can we scan well? Today, we are going to learn about these topics. Let's take a look at the Dio Navi process. First of all, the virtual crown is designed, and then we can start planning the optimal implant position based on the occlusal relationship and the patient's bone condition using a top-down method. As you can see on this slide, all of the bone, gingiva, and teeth information are needed in implant planning. Of course, the virtual crown design also requires an information of the antagonist. After that, you can design the optimal surgical guide according to the shape of the teeth and gingiva in the patient's mouth. For this to happen, accurate oral scan data is essentially needed for precise guide for fabrication. So far, we have learned why we need three kinds of information: tooth, gingiva, and bone. Then, we will learn how to use these three data. The Dio Navi Guide system uses 3Shape Implant Studio software to merge the CBCT data and the scan data. The patient's CBCT data provides accurate bone and tooth information. However, gingival information is difficult to clearly identify. In addition, teeth and gingiva information can be obtained clearly through intraoral scan or impression. However, the intraoral scanner does not contain information of the bones. This is the reason why CT data and scan data should be merged. To merge this, you should mark 3 merging points on the same point on top of 3 teeth, which are common data for both CT and scan. And based on that, 2 types of bone, teeth, and gingiva information are combined into one image. This is called the merging process. Then we will learn the whole process of image merging, implant planning, and guide design through a video. This is a mandibular molar case. Merge CT data and scan data by selecting 3 corresponding points. Create a panoramic curve and draw a mandibular nerve to accurately plan the implant treatment. Align virtual crown on the implant treatment area. Start planning the implant treatment, and you can determine the type, position, angle of the implant through the planning process. Manually reset the implant position to secure the safety zone between implant and nerve. Optimize implant planning by considering bone condition, occlusal relations, and prosthetic design. Mark the area for the surgical guide. Complete surgical guide design by forming a guide check window and a reinforcement bar. we have studied that precise scanned images are required for accurate guide design. However, when you conduct DeoNavi surgical guide surgery, you may have difficult situations due to errors in the scan data. In the next few slides, we will learn about the kinds of scan errors that might happen. First, the image overlap. This occurs due to insufficient experience in scanning. Therefore, this problem can be overcome with little pre-learning and practice. This is another image overlap case. If this happens, when the guide is placed on the tooth, it might be too loose or too tight of a fit. The next case is an incomplete scanning case. If the surrounding teeth or gingiva of the implant surgical area is not sufficiently scanned, the planner of the DeoNavi center will not proceed with the implant planning and guide design process. Another incomplete scanning case. Guide design cannot be proceeded because the scanning information of the tooth adjacent to the implant placement position is missing. Let's study in more detail the problems that arise when scanning is not enough. The green area on the mesial side of tooth number 27 indicates that scanning is missing. 3-shaped trios has a function to automatically fill this part. But look at the next slide. What happened? First of all, you can restore the missing area by 3-shape's automatically restoring function. However, after that, I enlarged and looked at the automatically restored area through the monocolor mode. You can see that it was restored differently from the shape of the original tooth. If a guide is made using this data, the guide may not fit well on the teeth, and you may have to adjust the inner surface of the guide. This case lacks scanning area. The teeth were well scanned, but there was lack of scanning in the implant placement area. 2 implants need to be placed, but implant planning cannot be performed because the gingival in the first molar is not scanned. In particular, in this free end case, sufficient data must be obtained by scanning a wider area. This is another case. The soft tissue on the left side has not been smoothly removed from the digital impression data, and the buccal side of the right arch has not been scanned sufficiently. So, this case may be difficult to progress because of insufficient scan data at the implant placement site. Let's learn how to scan well from the next slide. The scanning workflow varies depending on the oral condition, so let's see how to divide the case according to the patient's oral condition. First, the normal case. This is a case where there are relatively many residual teeth and no metal prosthesis. The second is the metal artifact case. Metal artifact occurs due to the metal prosthesis on the treatment area. Since you must attach a marker in the patient's mouth, you should use a scanning method that considers marker attachment. Third is the partial edentulous case. If there are few residual teeth on the treatment area, you can scan using a marker or a splint. Fourth is the edentulous case. Since there are no residual teeth, the patient's existing denture or rex denture should be used for scanning. Depending on the patient's oral condition, the appropriate scanning method should be used. Of the 4 cases, today we will study the normal case first. This is the most basic method. The method of obtaining the oral information is to scan directly using the intraoral scanner. The second method is to scan a plaster cast, made by taking an impression. We will learn how to use an intraoral scanner. You need CBCT data and scan data of the maxillary, mandibular, and the bite to produce the DeoNavi guide. There are no metal prostheses, so you don't need to attach markers in the mouth. CT should be taken with an open bite and with patient's head fixed. When you scan with intraoral scanner, you have to remember these two things. First, you need to scan carefully so that there are no empty spaces in the treatment area. Second, black and white mode is more effective for checking errors than in the color mode. Let's look at the scanning process of a normal case. The first step is to check patient's condition. If there are no metal restoration in the mouth and VD could be taken, you can use a normal scanning method. This is the Trios scanning method. The scanning should always start from the area closest to the surgery location. For the anterior, scan across labial and palatal area to prevent distortion of the scan image. The teeth on the surgery location should be scanned completely without any missing area. You should continue scanning on all necessary areas. You need to trim unnecessary areas, especially tongue and cheek. The entire surgery location should be included in the scanning area. Inspection in monocolor is easier to define the image scanning error, distortion, or overlap. The following is how to make a guide by impression taking. Equally, CBCT data is required, and the impression acquisition requires the maxilla, mandible, and even the bite index. In addition, when fabricating the plaster model, any deformation, distortion, or bubbles must not occur, so that a precise guide can be produced. The plaster cast will be scanned by the DO Navi Center when delivered to DO, so you don't need to have a DAS scanner for digital impression. Lastly, let's see a video of the plaster model making process. Let's learn how to take a rubber impression for a natural teeth case. If there are no metal restoration and we can check the VD, general rubber impression is required without any additional attachment of markers. You need to prepare the perforated tray and rubber type impression materials for impression taking. Actually, alginate impression is not suggested for DO Navi surgery. For fabrication of accurate guide, all treatment area including support area should be taken impression as well. When fabricating a plaster cast, you should be careful not to make any distortion or bubble on the cast. Otherwise, you need to take the impression again. This is a distortion case. It's important that the impression should always include the surgery area. Plaster cast can be broken during delivery to DO Navi Center, so please cover the cast with a bubble wrap for safety. That's it for today. Thank you. This was DO.